Sorry, I'm going to be hard to follow up that one. Now I'd like to introduce a dear friend of ours, Andra Stratton, who is the president and co-founder of Lipodystrophy United, to present our next award. Andra? Oh, and a very special award presenter, Lainey. Everybody, this is Lainey.
I didn't think that I could present our champion to you without a little help. So I brought up part of my family, Alani and Deja and Natalie. We are so honored to introduce you our true champion of hope for the lipodystrophy community. Those of us living with lipodystrophy have both visual and internal manifestations that compromise our quality of life every day. So you see, we don't have fat in the right places. And while we may look like the picture of health, in fact, we have serious metabolic and organ issues, really essentially from head to toe. Dr. A.Oral saw her very first patient almost 20 years ago when a father carried his daughter into NIH and begged for help. And Dr. A.Oral looked at him, and they knew it was lipodystrophy, and there was no treatment at that time. And she's not a quitter. She doesn't give up. So she found a treatment, and she's continuing to fight that treatment for all of us and additional treatments since then. She's really been instrumental in advancing research for us. And like that father, each of us has a story of lengths that she will go to treat us. She does not take no for an answer. And when you hear those heels clicking down the hallway of a hospital, you know Dr. A.Oral is coming to take care of you. Dr. A.Oral is our game changer. And because of her, little Alani here has the hope that her road ahead will be much smoother than those that came before her. When I spoke with the community, I asked, how would you like me to describe Dr. A.Oral? And they used words such as compassionate but stern. She's our doctor friend. She is exquisite. And I say that she is both our soft place to fall and our powerful commander-in-chief. Now I'd like to present this year's Rare Champion of Hope for Medical Care and Treatment to Dr. Elif A.Oral.
Going to be hard for me to do this too, so I brought something to cheat. Okay. The theme of this symposium is hope. To be called a champion of hope is very humbling. I thank Global Genes for giving me this award, but I thank my community for thinking that I'm worthy of this. As I was trying to get ready, I was looking for some famous quotes that describe hope. Hugo said, "There is nothing like a dream to create the future." And then the one thing that probably everyone knows is, yes, we can. You may attribute it to President Obama or Bob the Builder, whoever you want. but it's certainly it certainly is something that resonates hope. Hope is the belief that things will improve for the better. It is an inherent natural light that paves the way on our journey for which there is no final destination, really. I'm not the champion of hope, really. It's all of you, all of the patients here, all the families who are the champion of hope. They are the ones that deal with the difficulties of their condition day in and day out. My patients deal with a lot of different things. They have to deal with the judgment that comes from physical appearance. They have to deal with numerous medical problems. They have medication lists that reach dozens, and they have an insatiable appetite that they have to fight. But they deal with it with pride and with grace. It's really humbling to see your fight every day. When we started to work on lipodystrophy, we sought to find an answer to a scientific question. But more than that, we were seeking to provide care for our sickest patients at the time. I was about 27 when my first patient that you just described. And to be a postdoc and to be able to give an investigational drug to a very sick patient and to have seen a magical change within weeks was amazing. It was a miracle in the making. And I'm going to seek that moment again and again, and that's what keeps me going. And that's why we're now looking for the answers for our patients with for partial lipodystrophy as well. Maybe it will not be one drug, it will probably be numerous drugs, but we will not stop until we account for everyone. And as complicated as that task is before us, yes, we can, and we will. I want to end by thanking all of you, my patients, the wonderful larger community of lipodystrophy. They hug me with their love every day. I have a large medical team that work with me and that has supported me up to this point, and they have to deal with my ever-fleeting, changing priorities, which does happen, you know, when you look at a heterogeneous disease. I have wonderful colleagues who share the joy. They're both scientific colleagues, but I have wonderful colleagues from pharmaceutical companies who helped and who've really supported our desire to find hope for our patients. Lastly, I have a wonderful family who raised me. I have the opportunity to have my parents here, but I also have my own little nuclear family here, my husband and my 2 kids. They do believe in the value of this work, and luckily they are riding with me on this journey to the not so clear final destination. So thank you all. I think I did it.